Hello, I am Dr. Dudley Harris. I'm the founder of the San Antonio Eye Center. I'd like to introduce you to my good friend and colleague, Dr. Sanford Roberts. Dr. Roberts has had a long career of service in the United States Air Force. He graduated from the United States Air Force Academy. He then did his medical school in the Air Force, and he did his residency as well. And he went on to specialize in pediatric ophthalmology. Dr. Roberts spent 24 years in the Air Force, and when he finally retired, he joined our practice here in San Antonio in 2010.
Hi, good afternoon, Lisa. Hi, good afternoon. How are you doing this afternoon?
Well, not too badly, not too badly.
Well, I appreciate you coming to visit us. I'm going to just take a minute and I want to review the history you gave our helpers and look at your vision testing. Then I want to hear more about what brings you to see us today to see what we can do to help you, okay?
Okay.
All right, great. Well, let's see what your vision testing is. We want to do a good diabetic eye exam today. And how do you think you're getting along with your vision here?
Actually, I see pretty well, but my glasses are not up to date. I want to get a new pair of glasses.
Well, great. Well, we want to help you in that regard. I want to do a good thorough checkup of your eyes. And once I get a good peek inside, I'll know more and we'll go over all the findings with you and get you that new pair of glasses, okay?
Okay.
This is how I get to look in the inside of your eyes. I'm just going to tell my helper over here about your eyes and we'll go over all these findings momentarily. Mild MGI, nice, round and regular, deep and quiet. Has mild 2+ NS cataracts. This nerve looks about 0.25, normal macula and retina. Well, good news. Overall, your eyes look very healthy. I don't see any diabetic changes. I'm going to let your regular primary care doctor know about the results. And I'll be honored for you to take a look at our selection with Ron and pick you out some new glasses. And we hope to see you back next year.
Okay. Thank you very much. I appreciate it.
it.
People are often curious to know how a doctor chose to become a doctor in the first place, and how the doctor decided to become an ophthalmologist or what specialty to go into. They're also curious to know, how does a doctor keep up with the field that he or she has chosen? How do they study? Can they speak Spanish? And what do they feel about the practice of medicine? In this video, you're going to hear the doctor talk about those questions. And you're going to come to know who this doctor really is.
I got interested in medicine when I was at the Air Force Academy. I had a desire early on to fly airplanes. I had pretty good vision. My first year in the academy, it started getting a little blurry. And so went and got an exam and found out I was getting nearsighted myself. So that was my first experience when I then got to know one of the optometrists at the academy. A blessing in my life because it was a career shift. And at that junction, I loved biology, and that's when I got interested in medicine. Well, once I knew I wanted to be, loved hands and loved surgery, and during my 3rd year in medical school, I did some research and got involved with the retina specialist. And once he took me in the OR and I saw him peel a membrane, it was kind of like peeling a membrane off of the retina, and just the intricacy of that and how much better the patient could see. That was my first experience. I was like, wow, not only are they helping with vision, but cool toys and surgery. And he took me, he was a mentor that took me under his wing, and that was my first introduction to ophthalmology. But I wasn't really sold on the passion yet until I did my first mission trip. Well, my first mission trip was with a Christian organization to Mexico. This one little girl that was so nearsighted that all she could appreciate getting off the bus was just her mother's voice. But when we put these glasses on her and she could see her mom's face and the joy and how it changed her life, I was like, you know, what a blessing to be involved with that. So that was my first mission trip as a volunteer. That's one of the experiences. My very first patient I did surgery on there was a bilaterally blind gentleman just in his 50s, where his wife and his daughter brought him in. And I had the privilege to operate on this white cataract. You see it from across the room. And he couldn't even ambulate in without the help of his family. And so to be able to take that mature cataract out and the next day to see the tears in his eyes, and it's just very, very humbling. So I was pretty much sold. What an honor that we get to do to help our patients, and just something easy as glasses or with cataract surgery, but that changed me. Well, I graduated from the Air Force Academy I mentioned earlier, and ended up going to medical school at the Uniformed Services. They sponsored me with the medical school in Maryland, and ended up training in ophthalmology. And I was fortunate enough, I also love children, where they sent me to Duke to become a specialist for pediatric ophthalmology. So the thing I loved about the Air Force is that even though I love kids, I still love my adult patients. They let me do it all, and was able to help the flyers, and got to get to know and get in the aircraft. Even though I couldn't fly myself, I still got involved there with helping pilots with their eyes. And so it came full circle. I ended up retiring as a colonel, spending 24 years in the service, and I'm very, very grateful for that opportunity. The later part of my career, because I was the only Air Force pediatric ophthalmologist for the last 10 years, that I've probably done about 16, 17 missions, but didn't have to serve. And I have mixed emotions about that, but I took care of a lot of our vets here at BAMC and Wilford Hall, but didn't serve. Yes, my experience with patients with diabetic eye disease has grown tremendously. And while I was in the military, you had to be in pretty good shape. Not a lot of patients with a lot of bad, serious diabetic eye disease. And as I've transitioned, I've done a lot in diabetic eye care. And I think part of that is getting to know and becoming part of the team for your patients. Yes, since I've started my private practice here in San Antonio, I have a lot of patients that I take care of with very severe diabetic eye disease. Been able to save a lot of those patients' vision with some intervention. Many times as easy as just a couple of sessions of laser therapy. I take more onus with just the patients we can prevent getting to that stage. But I think once I've been able to get to know my patients and their regular doctor, and they understand the personal ownership of controlling their diabetes and how that is saving their vision long term, it's been more powerful than trying to fix it after it's broken. I loved ophthalmology, and I feel like it's a personal gift to be able to love what we do. And I share it with my kids, and encouraging them to find their sweet spot in life. That I would want to do this if we wasn't paid for it. It's finding the sweet spot. I'm not telling you her real name, but I'll just call her patient Virgie. And I'll share this story that just brought me so much humility and joy to be able to participate in patients' Virgie care. Virgie is 50 years old, and she has Down syndrome. And she is being taken care of by her aunt, and she doesn't know her parents. But I was about the 7th or 8th doctor that her aunt told me they brought her to, that was paused and was able to find out what was going on with her, because she lost the ability to even ambulate and find her way around her house. She used to be independent, go to the kitchen and get her food and take care of herself, but she became a recluse even in her own home. And patient Virgie had developed these bilateral white cataracts. And it's more common in patients that have Down syndrome. And because of her health condition, some of the other doctors did not want to operate on her. And because of my experience with operating on children and special needs kids, the family and I talked, and we were very apprehensive because we didn't want her to rub her eyes after surgery, to harm her eyes after the surgery. But with the family on board, we got a game plan, and just 2 months ago, was able to get the proper anesthesia team and support with her heart condition, and was able, under general anesthesia, to do her cataract surgery. Well, she has rehab now, and with the team effort, the joy that when she comes in, she just lights up the office. It's on our South Side office, and her aunt came in, and they found a whole bunch of other relatives. But instead of now them guiding her into our lane on the South Side, Virgie's just dancing and coming in, stepping up, getting in the chair. She's a different person. She's a different person. And to be able to be a part of that has been pretty special. That brought me a lot of joy recently. So I wanted to share that. I embrace my duty to teach, and I feel like it's part of our calling to give back to our specialties, to our specialty and the ones coming under us. I spend a day a week teaching young ophthalmologists our specialty. Many months I'm losing hairs, but many times I'm having the privilege of teaching them their very first eye surgery. They've been studying and training in their young 30s, and now they're getting to do their very first surgery. It's pretty special to see them grow and to see them mature, and to help guide them to not only become good surgeons, but to become good physicians and to really take good care and get to know their patients. And so I've been given some accolades, and I take that responsibility very seriously. I view my duty as a physician first and foremost is to do no harm, first and foremost. I feel like we owe it to our patients to pause and be very candid about looking across and saying, if that was me, if that was my mom, if that was my dad, if that was my family member, how would I want to be treated? And I feel like, when I've adhered to those tenets, patients appreciate it, and good things happen. And so that's what I aspire to every day. And I do feel like, first and foremost, you have to be experienced and humbled enough to know that you can't help. But it's beautiful and so awesome to be encouraged when you are able to help.